This decision for CAR T, this is a decision whether or not to allow a patient access to a life-saving therapy potentially. So it cannot be taken lightly. It needs to be based on sound judgment.
On CAR T cell therapy, which is a very complex therapy for advanced cancers and requires a huge team of people and resources. So we recognize that there's been challenges in providing care or CAR T services because there are often wait times for manufacturing, or there's a long list of patients trying to get into these complex spots. But the actual process for prioritization of one patient over another was fairly informal. And typically, unfortunately as well, patients often would move to the top of the list based largely on how vocal their advocate was.
Recently, we published a paper in Blood detailing our approach to developing an ethical framework for allotting patients to scarce CAR T cell therapy treatments. Enabling a process where we have clear criteria by putting some structure and transparency around the decision making.
The framework is not meant to limit access to CAR T cell therapy for patients, but rather to prioritize the order in which patients proceed.
I really hope that this framework can enhance a national discussion around prioritization of patients to CAR T cell therapy. We know that there's only a few centers in Canada that provide this therapy. How do we think about this across Canada in a pan-Canadian way so that it doesn't matter if you're in northern Manitoba or if you're in downtown Toronto, you have equitable access to CAR T cell therapy?